So I'm Charlotte from Blackburn with Darwen Public Health Team, and I'm here with Dilwara, who's from Healthy Living, which is one of our community providers. And we wanted to share our Blackburn with Darwen journey so far, and it is a journey, and we talked about that a few times, that there's no end point to this, it carries on. But we've been working on it for a long time in Blackburn with Darwen, and we want to be able to share sort of some of the progress that we've made, different things that we've tried, things that have worked, things that haven't, and where we want to go to from here. So we've called it Making It Happen because we feel that's what we've been trying to do, but we haven't made it happen, we're making it, it's a journey. So I think somebody mentioned around 2012 where Blackburn with Darwen commissioned a population level survey to look at the amount of adverse childhood experiences that had been experienced by adults within our communities. So we did a big piece of large-scale research. Around 2,000 adults were asked around adversity in their childhood and their experiences. And we found that almost half of all adults in BWD had experienced at least one adversity, and 12% had experienced 4 or more. And again, there was an earlier slide sort of sharing the outcomes related to that in terms of health and social outcomes that are associated with the more races that you experience, the risks with that. This was consistent with the findings that had already come through the US. So this is something that had been starting to be looked at in terms of why is it that certain people are, why are we seeing such inequalities in certain areas, and about the experiences that lead to that. So I guess from a public health perspective, that's what a lot of the work that I do is around sort of looking at data, looking at understanding our population levels, and how do we start to make a difference, and what can we do with that. So we set out, after we got our base level data, 2012, we set out to a commitment that we've made, an ambition towards creating trauma-informed organisations and trauma-informed communities. And we knew that it wasn't going to be a quick win. We knew that it wasn't going to be something that would happen in the next 2 or 3 years. And here I am, 12 years later, and we're talking about it, but we have made progress, which is fantastic. So we wanted to look at how do we start to reduce the incidence of trauma and ACEs within our communities, and the impact of that as well, so try and lessen the impact. We've moved away from, obviously, adversity and ACEs is kind of what formulated that the evidence base for us to be able to understand it, but we've moved away from that. I know we talked a little bit about language then around, do we call it trauma-informed, what do we call it? We've moved away to thinking, yes, there is about adversity in childhood, but trauma exists in so many different places, and it can mean so many different things to different people, and it's a recognition of that. So I think it's really important that we kind of acknowledge that as well. So once we'd got our information between 2014 and 2019, up to COVID, not like a special time, which was a trauma in itself for so many people, there was a lot of movement that happened for us in Blackburn with Darwen, a lot of activity. So we started to do citizens' inquiries, and Dilwara was going to talk to us a lot more about that, about actually going out into communities and talking to people about what trauma means, and actually does the word trauma mean anything, and how do we work better. We started to show a film called Resilience. Some of you may have seen it or may not have seen it. In community settings, and we had support around the questions and answers that people might have around that as well. We developed an ACEs animation. Some of you might have seen this one. It's been out there for a while, obviously, from 2012. I think it was 2013 it was published, about a young boy and his experiences as a child, and how different ways of working with those experiences might have led to better outcomes for him. We're actually working on a new animation at the moment, which is really exciting, with the same animation company, but to represent our cultural diversity within Blackburn with Darwen, which is really important to us. We developed a toolkit for working with children and young people, which was co-produced with children and young people. It was about asking, how do you want to talk about this? What's important to you in the services that we deliver? We also brought in routine inquiry, and we talked about that in an earlier presentation, about how do we made sure that all of our health visitors bring into all of their interactions with pregnant mothers and new mothers around adversity, to try and think about the impacting the connection around how do we stop re-traumatisation, how do we stop generational trauma, how do we sort of impact that cycle. And we developed an ACEs hub for support sharing our resources. So we did lots and lots of things, really loads of activity, but it wasn't like there was one overarching structure for this. There was just lots of people wanting to make a difference. So I guess then what came next after COVID was, I wasn't part of that, I have to say, I'm sharing this. I came to Blackburn with Darwen in 2020. I picked this up under the Children's Partnership Board, so it's very much directed within our children's work within Blackburn with Darwen at that time. And it was very quickly, it was how do we start to create a structure around this which enables it to grow in a meaningful way that people can make sense of and can contribute to in an effective way. So we looked at it from a socio-economic perspective. That's kind of nice, like theoretical framework. But what it means is that the individual's at the heart of that, and it's all the ways they interact with those around them, with their peers, their family, their communities, and the wider systems around them as well. So our policies, our practice, how does that impact on the individual at the heart of it? And we developed a framework for working as well. So we now have a strategic forum who meet on a quarterly basis, and it has a direct responsibility to feed into our partnership board. So the Children's Partnership Board, the Place-Based Partnership Board, our Agewell Board. And we've developed managed networks across Blackburn with Darwen, so we can have meaningful conversations that make sense to the people that sit within those networks. And they're not closed, they're open for growth all the time. So we've got 3 that are related to young people. We've got an early years network. We have our education network, which is growing to include further education and adult education. We have a vulnerable young persons network, which has just begun recently, but these are all co-chaired by people in the community settings as well as within a local authority. Communities Network, which is led by Dilwara and Michelle Rutherford, who sits within our neighbourhoods team within the local authority. And we are looking at developing a vulnerable adults network, and the way that we're working around adults, because it's so huge, is how do we bring that together. But we're really proud of the structure because it's enabled people to make sense of what we're trying to achieve and contribute. And we set ourselves some very clear objectives. So leadership, and leadership isn't about leading from the top. It's about a top-down, bottom-up approach. We want to listen to people. We've heard how important that is. We're not going to get these things right if we're not listening to our workforce, to our communities, to people who live, breathe, play, all those things within our area. Our main objectives around training and workforce development, a commitment to making sure that everybody has access to appropriate training to support them to be able to do their jobs in a really good way. So that might be basic awareness training, that might be more in-depth training. But we've made that commitment. We've made a commitment to organisational development. So we're using the Lancashire VRN self-assessment tool, and we're encouraging all of our settings, teams, organisations to do the self-assessment audit, to develop action plans so that they can actually start to see how they can tangibly move along a pathway to becoming trauma-informed themselves. And we've also set a commitment to becoming quality assured. So using the one small thing quality mark, we've got a budget there to allow people to be able to go for that because there's a cost associated. But we want people to be able to see where they're going with the progress towards becoming trauma informed. And like I say, it's not that end point, but it's a journey of understanding how we get there and marking that along the way. And some people love that. Some people are all about quality mark. Some people think, oh, not bothered. But either way, it's quite a useful tool for seeing where you are.
So, as Charlotte said, I'm Dilwara. I work for a charity based in Blackburn, Chief Officer there. So we've been working, there we go. We've been working and we've been commissioned by Public Health as well as LVRN to deliver some citizens' juries as well. So, as I said, we've delivered 3, one for Public Health, and that was around ACEs, and the 2 other were funded by LVRN, that was on trauma-informed work around ethnic minority, as well as a separate one for the British white community as well. I don't know if everybody here knows what a citizens' jury is, so I'm just going to go and just tell you about basically what it is. It's looking at community development theory that people are best known, and we've all morning talked about what the community know is getting their ideas and embedding that within our community. And that always shows a greater impact instead of us sitting in our offices and parachuting in and saying, this is what we think. And I think Mike earlier, we always thought that we knew best, but we don't. And we've, I don't want to go into full details into what Mike talked about and me repeating myself as well. But through experience, we know that when we speak to the community and the community tell us what's important to them, what makes them tick, and we embed that into our work, it really does work. So, and this approach has been done many, many years ago through that community development theory. And we've been doing this in our borough for a long time. And as a charity, we do these focus groups, citizens' juries, for many, many years. So, like I said, we were commissioned by Public Health and LVRN to do this work. So, I'm not going to go into this full details, but so why was it taken the citizens' jury approach just to make it so that the citizens are given that discussion, they can sit there, and it's that whole 10, 9, 12 weeks almost. So it's not one session that they're sitting there, they're talking to us, and then you get speakers, professionals from different areas of that subject that they can sit down and inform us about all this. When we did the citizens' jury, it was the community that told us and broke it down into different levels. It wasn't us saying, oh no, we need to put it into the early years engagement with new parents. So that's the midwifery process, then the post-delivery as well. Primary school, secondary school, and then adulthood as well. And they also talked about things that were already happening. We've got a school in our school, which was Witten High, that already developed some models that they worked with Embrace that really worked as well. And they also wanted to say that what we were working with is these are the kids that are going to be our future. Some of us have been through lots of trauma. We're in our early 50s, late 50s. It may be quite hard to take and start talking about all this. But if we start working with those children, because ACEs doesn't have to follow you throughout life, and that's what it shows as well. So these were some of the key recommendations to actually start embedding all this from professionals through university. And I think I'm rushing because Justin has just said I've only got 5 more minutes, and Charlotte's got a bit more as well. So when we did the trauma-informed approach, Charlotte said we had moved on from the ACEs approach. Again, the community said we needed to break it down. Children and young people, adults, and that included the community and professionals, the workforce. And that was really, really important to us, that not just the professionals going on this journey, it was important that the community needed to be on that journey. And one of the things that we learnt as well, we had somebody from the North West Ambulance Service in Manchester who came to talk to us as one of our guests. And some of the work that they've embedded in Manchester is absolutely quite fantastic. And the community were really impressed about how that work is being embedded. Language, we've talked about lots of things about language, the way we speak to our body language, even when we talk to the community, can tell a different story. And again, the asset-based approach, which is another word for things like lived experience, it's really, really key. So these were some of the comments from the jurors. So building awareness around all trauma-informed communities. It felt that when we explained about being trauma-informed, they got it. That key always, when I go and present, I always use that term when we talk to the community. They get it. They get why some people might act or behave the way that we do in troubled families or some individual. I think one of our speakers earlier said about they didn't want to put a ball out because they might throw it at somebody. But those sort of behaviour, even the community got it, where somebody like their neighbour might behave the way they do. So it was important that we set up these flat platforms, and we needed it to be long-term, not short-term funding. It needs to be a long-term thing. So I'm just going to whiz through it. Maybe you can read some of these presentations afterwards. So what did we do at Healthy Living? So we got this citizens' jury funding, short-term funding, but I went to, and when these comments were made, I thought, well, I need more money. I need to retain these juries. I needed to retain some of these volunteers. How do I do it? I'm a charity. I haven't got a big pot of money somewhere that I can continue to let my staff continue to work with these. So we went to affordable, I'm saying affordable Awards for All, that's a completely different subject. Awards for All from the lottery, and we managed to secure some funding. And now, when we worked with the community, they had learned all that background, and we started to say, well, now you tell us, how do we develop a workshop that you guys go into the community and deliver this? So it's you speaking, not me going into a community and saying, I know best, this is how we're going to do it, this is what I've learned from my training, but it was the community, going out into the community and delivering it. And we've been doing that for a while. Again, the outline of the workshop, we got some help, making sure that these individuals got some training as well, how to go out into the community, maintain their boundaries as well, that they're not going out there giving wild information. And so we've got Sue Irwin, many of you may know Sue Irwin, who is from Embrace, and we helped some of those. And it was them that came out with the ideas of how they're going to do it. And they've been delivering for a while in the community, and we are getting external evaluators to evaluate our work. So where is the future? And this is some of the outcomes that we had recruited about 12, 13 individuals. As many of you will know, volunteers have lots of different life, and they get a new job, they move on, but we've got really committed two at the moment that have been doing it consistently. And now what they're going to do is, where Charlotte talked about the trauma-informed network, they will now sit on the network and just guide us along as well, making sure that that input, that when they go in the community, they're feeding it back into those network, and it goes upwards as well. So that top-down, bottom-up approach is going to really be embedded into Blackburn.
This is really quick. This is just to demonstrate a little bit about how we work together. So something we're really proud of is we've just very recently launched our very own BWD Basic Awareness Training Programme, which is based on the LVRN training programme, which many of you, I'm sure, will have attended. And what we have done in Blackburn is we have brought together a partnership of staff, so from our community providers and our people with lived experience, from within the local authority. We've got people across the life course, so we've got from Young Carer Service, we've got people in the room who train on this programme for us, we've got Age UK, a whole group of people, 22 members of staff who come together to create our training team. And we've been able to put on 20 training sessions will be delivered over the first 12 months with an ambition that this will continue and grow. It's a training programme that's available to our entire integrated workforce, so it's there for anybody who works within Blackburn with Darwen to attend. We've really sort of taken the bones of the VRN training, and we've made it a Blackburn with Darwen programme for us that meets the needs of our communities, feeds into our services, our referral pathways, and we're really proud of it. So far, we've just launched it a couple of months ago. 100% of participants agreed that their confidence had increased in understanding trauma and how to work in a trauma-informed way as a result of attending the training. We do recognise that most staff are currently from local authority, and what we're looking at is how do we engage with different people to ensure that the right people are having that training. And that's about all of our services, so thinking about our transport services, our frontline services. How do we ensure that everybody, it's not, we're preaching to the converted in this room. How do we ensure that other people understand what we mean when we're talking about working in a trauma-informed way, and how that will change the way that people will respond to your service or to whatever it is that you're doing. And that's the most important thing, that it really will make that difference. We've got a lot of next steps, so we're producing a mandatory e-learning programme which will be 45 minutes long. All of our council staff that'll be part of something that they have as a matter of course. This is what you can expect by working in BWD, and this is what we expect from you as well. This is the support that's available, because it's very much about how do we support our workforces to protect themselves when we know that so many are coming into contact with other people's trauma on a daily basis. How do we prevent that burnout? It's really important that we're looking at that. We'll be launching our leaders and managers training and advanced practitioner training over the next couple of years. That's the next step of our journey, beyond the basic awareness training. We're very much focusing around our staff supervision and reflective practice, so it's not just about how we're out there doing it. How are we supporting the staff who are, or the volunteers, we've got and the champions that are doing all of this work. How do we support them and ensure that they've got the support they need to carry on? We're in deeper engagement with our voluntary community sectors and private sectors, so our private industries as well. And ensuring that we're aligning our practice with our policies. Comms, and we've had that on the previous presentation, and we're very much looking at those further opportunities as well. And we're looking to launch all of our materials at a conference next year. So lots of really exciting things, and hopefully you might have picked something up about what we've been doing in Blackburn with Darwen. So thank you.